Families become family with a local support group, and you can have a stronger tomorrow by setting your health goals today. This is the Regional Health Report. Welcome to the Regional Health Report for July. I'm Ann Krebs. Family readiness groups help families become more resilient and able to cope with deployments. But what services are available to the wounded, ill, injured, and their families? Dan Ashley brings us the story of one family that found much more than assistance.
I ended up here at Walter Reed in 2016. My unit was assigned to a NATO training mission. We were doing a live fire exercise. One of the Bradley fighting vehicles had a misfire, and myself and the master gunner went to clear that misfire. When we went to clear the misfire, the round detonated, and I sustained injuries to my eyes, head, and my ears, along with flash burn to my head and upper left part of my body.
After my husband's injury, we were so lost in the Walter Reed culture for wounded, ill, and injured soldiers. We received help with child care options, housing options, vehicle transportation, resources.
My role is to make sure the wounded, ill, and injured, their families, cadre, their families, as well as our employees, are all taken care of. It's building unity, building a family outside of your regular family.
When she asks about your family, she asks about what's going on, she genuinely cares. And when you tell her something or say something's not quite right, she's going to get on it. And I can about guarantee if it ain't by the end of the day, it'll be within a day or two, you're going to have some kind of answer or it'll be some kind of plan of action.
In the room, I think we're going to need laundry detergent.
Okay. The one thing that I will say about Mrs. Gould is the fact that she is a pay-it-forward type of person.
To the family that's new here, I would definitely say keep fighting. Don't give up on yourself. Don't limit yourself based on, your disability or your sickness, your illness, injury. Don't stay to yourself. Don't be too proud to ask for help. Everyone is pretty much here for you, but they can't help you if they don't know, what you need or what you got going on.
Her and the organizations and resources that are given have helped given me personally back a piece of myself and have helped me maintain my family. And that's probably the biggest thing I can say that any of this has done is taking care of my family. It's taking the burden off of me. I know that I got someone in my corner. It's just not me in the fight, and I'm grateful. It's a blessing.
Next, the Fort Campbell Army Wellness Center offers free classes to help prevent chronic illnesses and promote healthy lifestyles. Here, counselors can help create an individualized wellness plan for beneficiaries to help them achieve their wellness goals.
Our services that we provide, actual appointments, are we do body composition testing with our bod pod. We do metabolic testing to help with individual calorie count. We offer individual stress management. We also do physical fitness testing to help prescribe exercise prescription or individualized plans. And we also offer general wellness education, and we do individualized health coaching sessions as well.
I came in and I did the metabolic test in September of last year to find my resting metabolic rate, and then I came back in and I did the class to get all my numbers and find out what I needed to be eating and my percentages, and that was basically the start of it. I started dropping weight, and I think I'm down from 180 to 161 right now.
All of our staff does have a minimum of a bachelor's in an allied health field. Most of them hold it in the health and human performance realm, exercise and sports science, health education. Our health educators, in addition, also hold one or more nationally accredited certifications in this field as well.
Obesity down here, diabetes. We see a correlation there?
I feel stronger. My energy level is way different. I feel like I could get up in the morning and I'm not super tired throughout the day. I can stay awake at night. I don't feel like I'm exhausted and I need to go to sleep.
The Army Wellness Center, we offer standardized primary prevention programs for our soldiers, their family members, DA civilians, and retirees. It is no cost associated with it.
In other news around the region, Brigadier General Toledo Crossland assumed command of Regional Health Command Atlantic during a ceremony hosted on June 5th at Fort Belvoir, Virginia. Before assuming command of Army Medicine's largest healthcare region, Crossland served as the Chief of Operations for U.S. Army Medical Command and Office of the Surgeon General. Also in the news, Staff Sergeant Ross Alwine, assigned to the Warrior Transition Battalion at Fort Belvoir, won the gold medal to earn the title of Ultimate Champion at the 2018 DoD Warrior Games. The Ultimate Champion is the athlete who earned the most points in 8 sporting events. That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Flipboard, Pinterest, and YouTube. We're also on iTunes. Thanks for joining us.